So I want to welcome everybody here. My name is Seth Hyman. I'm the proud dad of little Rebecca, who's 9, who has 1 P, and 15-year-old Melissa, who is in the back there with my wonderful, beautiful wife, Danielle, all the way in the back corner by the door, and that's Rebecca with her hand in her mouth. So it's been quite some time since we've been to one of these conferences. We were at the first 2, and then a lot of things have happened in the middle, and here we are again. And before I start and tell you a little bit about myself and why I'm here, literally a half hour ago, I was sitting down and I said to myself, I wonder how many people in this room have heard this particular poem. So I went around and I asked a couple of people, and they said, no, I never heard of it. So I said, you know what? Let me go into the business center and print it out and read it to you. Because I think when I read you this poem, if you haven't heard it before, it's really going to hit home. So I want to read this to you. The name of the poem is called Welcome to Holland by Emily Pearl Kingsley. I'm often asked to describe the experience of raising a child with a disability, to try to help people who have not shared that unique experience to understand it, to imagine how it would feel. It goes like this. When you're going to have a baby, it's like planning a fabulous vacation trip to Italy. You buy a bunch of guidebooks and make your wonderful plans. The Colosseum, the Michelangelo David, the gondolas in Venice. You may learn some handy phrases in Italian. It's all very exciting. After months of eager anticipation, the day finally arrives. You pack your bags and off you go. Several hours later, the plane lands. The flight attendant comes in and says, welcome to Holland. Holland? You say Holland? What do you mean Holland? I signed up for Italy. I'm supposed to be in Italy. All my life I've dreamed of going to Italy. But there's a change in the flight plan. They've landed in Holland, and there you must stay. The important thing is that they haven't taken you to a horrible, disgusting, filthy place full of pestilence, famine, and disease. It's just a different place. So you must go out and buy new guidebooks. You must learn a whole new language, and you will meet a whole new group of people that you've never and would not have met before. It's just a different place. It's slower paced than Italy, less flashy than Italy. But after you've been there for a while, you catch your breath, you look around, and you begin to notice that Holland has windmills, and Holland has tulips. Holland even has Rembrandts. But everyone you know is busy coming and going from Italy. They're all bragging about a wonderful time they had there, and for the rest of your life, you will say, yes, that's where I was supposed to go. That's what I had planned. And the pain of that will never, ever, ever go away, because the loss of that dream is a very, very significant loss. But if you spend your life mourning the fact that you didn't go to Italy, you may never be free to enjoy the very special, the very lovely things about Holland. And the reason why I wanted to read that poem was because every time I think of parents like me and these kind of groups, it reminds me of the poem, because I would never have met you if it wasn't for my daughter. And none of us in this room would have crossed each other's paths. And maybe you've developed over the years great relationships and friendships and possibly even business, you never know. But we're all here for a reason, and we're all here to make the best of it. So I want to tell you a little bit about mine. And it all really started with the birth of little Rebecca. Rebecca is 9 years old, and Rebecca has 1P36. And when Rebecca was born, and that's my family, Rebecca's in her favorite, one of the favorite things she loves to do. She loves to swing. And she loves the water like most of our kids. And one thing that I learned when she was born, very early on, when we went to our first specialist, and he told us Rebecca needs a trach. If Rebecca doesn't get a trach in the next 2 weeks, Rebecca might die. And at that point, when she was very young, she wasn't diagnosed with 1P. We didn't know what was wrong with her. We knew she wasn't like all the other children. We knew she wasn't developing at her pace that she should have. She was having significant breathing problems, GI problems, but nobody could put their finger on it. So we trusted the doctors. And the one thing I realized early on is that we can't rely on the doctors for all the answers, because we live this every day. There's nobody, unless they're in their shoes, who could say, you know what, this is what I think you should do. Unless you live what we live every day, it's very hard for somebody to truly get it. Even people in the special needs community who I work with all the time, some of them don't even get it because they never lived it. And the one thing, like I try to explain it to families of typical children, is that imagine the nights and the days when your typical child was sick. And they're really sick. They're up all night, the stomach issues are going on, they're vomiting, and this is going on for 3 or 4 days. And you're losing sleep, and you're missing work because your typical healthy child is ill. And you will do whatever you can do to help that child get better. But the one thing that you look forward to is, you know what, in a week, my child will be better and things will be back to normal. But many of us in this room who have medically complex children truly understand that that will never change. The children who are severely medically complex, like my daughter, I always, and my wife and I, we always know that we always have to take the best medical care of her. So she's not going to get better in a week or two, and it's just magically going away. So I think for many folks, it's very difficult to truly understand what it is that we go through. And what I've learned is the more and more I explain to people and share with them different situations and scenarios like that, then they try to grasp it and understand it. So early on, what I figured out was that being an advocate is probably one of the most important things that I need to do at the time of my life, because I couldn't rely on the doctors, I couldn't rely on the folks in the school system, and even some of the advocates weren't steering me in the right direction. So what I did was, I said, I want to get involved with my community. And I started looking out in my community, and I happen to live in Broward County in South Florida, and I noticed that there were some really important, significant children's organizations that truly had an impact on the children in our community, let alone the children in our state. And what I realized after I went to my first or second meeting was that, hey, wait a second, I'd really like this. I really feel that I'm serving a purpose. I don't drink, I don't smoke, I don't do drugs, and people say, well, what do you do for fun? You know, what's your outlet? And what I realized very early was that that's my outlet. Going out and speaking and helping others and giving people advice so, you know, they don't have to have the same learning curve that I had, that's what made me feel good. So not only did it help me feel good, but I was also making a difference not only to my own child, but I was also helping others. And one of the things that happened was, we all know the expense of doctors and hospitals, and for us, that was taking a huge strain on our family. And here in Florida, we have something called the Medicaid Waiver. And I think in many other states, they have similar programs. Some don't, some do, some have it even better where there's no waiting list. But Medicaid is a income-based program, so you have to make a certain amount. Well, you actually can't make more than a certain amount because then you're not qualified. But with this program, it enables you to get Medicaid for your child regardless of income. But unfortunately here in Florida, there were 20,000 people on the list. And I knew that without getting my daughter this waiver, it would literally put her life in jeopardy, because the traditional health insurance companies weren't paying for many of her services and things that she needed. I truly can only do so much, and all of us can only do so much. And lo and behold, by getting involved in the community and getting involved with these organizations, I was having meetings and meeting people in Tallahassee, and I was making a difference. And I basically fought for many, many years until I was able to get my daughter this special Medicaid waiver. So once I did that, I realized that, you know what? It feels good. I'm making a difference. I'm helping my daughter and I'm helping others. What else could I do? So let me just go over to the next slide. And when we were talking before about what goes on in our lives, nobody knows, when you walk out your door in the morning, nobody knows what you experienced. Nobody knows what your life was like the last 24 hours. I saw a mom in one of Rebecca's special needs classes, and somebody said to me, what's wrong with her? Why is she such a you-know-what? And it all comes down to people on the outside, they don't know what our last 24 hours were like. They don't know what we went through. They don't know you were up in the middle of the night with 5 seizures and vomiting and G-tube changes and poop and feeding and venting. People don't understand that and they don't see that. So I started to share, and my wife and I started to share a little bit more about our life with others so that people could truly understand. And one thing talking about the advocacy component is that it's so important for us to, if we want to have an impact, to really have a plan. And I think I put it down here where, well, the plan is coming. Children who have consistent, knowledgeable advocates are the most likely to receive appropriate services and support. And I think that is so true. And many of us in the room are great advocates for our children. And the question is, can we also make a difference in other people's lives? And I think by getting involved in your community, whether it's many counties here in Florida have something called the Children's Services Council. I think in Florida there are 13. And this is an organization that is funded by property tax, and they fund a lot of special needs programs, after-school programs, foster care programs. So I think in many of the communities throughout the country, you have all these different programs that folks like you can get involved with. So if there's something that you need that you're not getting for your child, and it gets back to entitlements. I never want anything more for my Rebecca than what she's entitled to. So if I go somewhere, I don't say, well, my child has special needs, this is what I want. Because there's just so much you can push people. But as long as you know what you're entitled to, whether it's health care, especially in the education system, our children have certain rights. And as long as you know what those rights are and you're very clear on those rights, then you can go and fight. But you can't go and fight for something and say, well, my IEP was just done last week and my child's not getting enough PT and OT in the school system. Well, there are certain laws, there are certain limits on the amount of therapy children could have within the school system. So it's very hard to fight for something unless you know what your limitations are. But once you know what those are, then you can go, to the end of the earth to make sure your child gets it. I have so much to talk about because I'm covering 2 different areas. I'm covering advocacy and the importance of medical marijuana for the treatment of epilepsy. So let me move along. As far as advocacy, well, what is it that we need to follow? Well, we need to get everything in writing. And here's a list of some essential things that we really need to focus on. If it's not in writing, it's going to be very hard to prove. So you need to work out your problems locally, on a local level, whether it's with the healthcare system, whether it's with the educational system. Again, in writing, there's a great website there, Writes Law, that will give some examples of letters on how to compose a letter and send it out and really have a great impact. And they show the do's and don'ts. Because another thing that came up many years ago was parents who go out and who try to get what they need or what their child is entitled to by attacking and being mad and angry. I realized a long time ago that really doesn't get you very far. It just makes the other side more angry and they get very defensive and you get nowhere. So these letters that are on this website will give you different scenarios and show you that. Timelines are very important, especially when it comes to healthcare and education. So write down your timelines, what you want to accomplish by a certain date. Also expectations. What is it that you expect to get out of your objective that you want to meet? Is it, I mentioned before, therapy in school? Are you trying to get therapy covered by your insurance company? What are your objectives? And then go through your checklist and just knock off one by one. If you ever speak to people on the phone, that too. Who are you speaking to? I mean, I'm guilty of it, calling a doctor, getting somebody on the phone. I go through my whole story, I need this, I need that, and then I hang up and I get disconnected and I have to start all over again. So it's always very important when you speak to people, get their name, get their title, what is that you discussed, write down the dates, because by having a journal or some sort of, track record in writing, it'll be a lot easier moving forward. One of the things that I'm real proud of that led from my advocacy work is when Rebecca was very ill in the hospital, I ended up meeting a lot of folks in the community who had impact on children. And some of the people that I met were in law enforcement. And early on, in Rebecca's early years, we would have to call 911 2 or 3 times a week. She would have seizures, stop breathing, and every time EMS came, it was the same thing. What's her name? What's her allergies? What's her diagnosis? And they kept asking the same things over and over again. This was 7, 8 years ago. So a lot has changed now with medical records and Hipaa laws. And what I found out was that wouldn't it be great if we, as children with special needs, if there was a way to document all of this information in a very clear and concise form. It wouldn't be held electronically because most police departments and emergency medical organizations don't want to have more data, and if they do, it's very expensive to maintain. So the simplest thing we came up with was a form. Now, if you go to the Broward County Sheriff's website, right on the homepage there on sheriff.org, on the lower right-hand corner, you'll see a little picture of Becca, and when you click on that, it'll bring you to this page. And there was a program named after her. It was called the Becca Program. It stands for Broward Emergency Critical Care Assistance. Don't ask me how we figured that one out, but I think it was a night when we were up late. And this is a place where folks can go and they can read a little bit about Rebecca. But more importantly than my story is, how can this help others? And we basically created a very simple form that parents can go, they download this PDF document, they save it to their computer, they fill it out on their computer, and all the information is saved in this PDF document. And the reason why that's important, as opposed to printing it out and filling it in, because when it comes to meds, a 7 could look like a 1, or a 1 could look like a 7. So especially during an emergency situation, the last thing you want to do is give the wrong information. So you guys could even do this. You can go and download this form, fill it out, you type in all the information, you save it to your computer, and you print it out. When things change, open up the document, go in, modify it, update it, print it out again, put it in your child's backpack, keep it on the refrigerator. Because when EMS comes to your door, as they did in our case, and in many cases Rebecca was on the floor and turning blue, and they're asking, what meds is she on? And my wife and I are like pulling our hair out. I don't know if that's right. And so this is a great, great resource. I wish I had more time, but I know that I don't, so I'm going to move on. I just want to leave you with this, with advocacy. There's nobody better to be an advocate than you yourself for your child. The system is very, very complicated. There are so many things, so many obstacles put in front of us that we have to get over. And the harder you work, there are a lot of folks out there who are willing to help, whether it's family, people in your community. So just keep fighting, and you will truly make a difference in the care that your child gets. And try not to rely so much on those who you put on a pedestal, who you think might know more, but in actuality, they might not. And don't get me wrong, there are great doctors and healthcare providers out there, but many of them don't know as much as we do. And the story that I tell is, I remember one of my daughter's GI doctors, my wife asked him, let me ask you a question. How much formula do we give Rebecca? And I think he gave us the greatest answer. He said, I don't know. I don't know. You'll know. You'll find out, because by you giving your child formula, you'll realize how much they can hold down before you see them squirming. So you're going to need to be the judge. And I think that really could be applied to a lot of the different things that go in your child's life. You're the best judge. So keep doing what you're doing. If there are any questions about advocacy, I'll be more than happy to answer them.